And now I'd like to introduce and welcome today's presenters. Ana Beltran is a longtime valued national expert on issues impacting grand families. She has provided technical assistance and training to countless state agencies, legislators, and legal providers, resulting in policy and program reforms for the families. Ms. Beltran has worked in all three branches of the federal government and was a practicing attorney before finding her true passion, helping support grand families. Jaya Lent is a trusted voice on Capitol Hill on issues related to grand families and intergenerational cohesion. She has testified before the U.S. Senate Special Committee on Aging and serves as co-chair of the Federal Advisory Council to support grandparents raising grandchildren. Under her leadership, legislation has passed to support grand families in areas ranging from housing to family caregiving to child welfare. And Sarah Smalls, Sarah's journey as a kinship caregiver began in 2002 when she learned that her granddaughter's mother was leaving her granddaughter with people involved with drugs and was not caring properly for her child. Sarah fought in court for legal custody of her granddaughter and a few years later was granted custody of her two other grandchildren. Sarah had to relearn how to be a full-time parent after 20 years and stretch her and her husband's fixed retirement income. She had little guidance and would have benefited greatly from kinship navigation services that could have directed her to things like healthcare, childcare, and mental health services for her grandchildren. And now I will turn the floor over to our presenters. Thank you.
Thank you so much, Beth, for this opportunity. I'm really honored to be with you today to talk about facing a pandemic, grand families living together during COVID-19, and thriving beyond. Yeah. Okay, great. So first, to just share a bit about Generations United, our organization. Generations United's broader work looks at issues that connect the generations and ways we can better bring older and younger people together to support one another. But we are home to the National Center on Grand Families, which was founded in 1998 and has a broad focus in terms of supporting grand families. The work of the center, first and foremost, is guided by the voices of caregivers themselves, a national network of caregivers that represents 45 states and 11 tribes, and I'll talk a bit more about that in a moment. We also lead an advisory group of organizations, national, state, and local, in addition to the caregivers and youth that help to set that national agenda. And we conduct federal advocacy on behalf of grand families and help them learn to advocate for themselves or increase their skills that they already have to better advocate for themselves and their families. We provide technical assistance to states and other providers, and then also raise awareness through the media, through weekly communications and events. And all of our resources, we will highlight a couple in particular, but they can all be found at gu.org. Those are Generations United specific resources, and grandfamilies.org hosts a whole range of resources that can help grand families in the field. A bit more about our network. Our goal with our network is really to have everything that Generations United does driven by the voices and the wisdom of those caregivers that are living the lives of being grand families. It is a select network that represents 45 states and 11 tribes. We have about 70 members so far. And just will flag for you, if you happen to be in a state where you are interacting with a caregiver that you might want to recommend to join it. We are missing currently caregivers from Arkansas, Delaware, Hawaii, North Dakota, and South Dakota. So we'd welcome any suggestions that you have. It's a wonderful opportunity for caregivers to learn about policies and supports, understand what's happening in other states, and to have a direct connection to our organization and to guide the work that we do. And we regularly work to connect our members to the work that's happening out in the field. So also, if you're interested in connecting with one of our members as you do work, we're happy to make that connection for you. First, a bit about the numbers of grand families. So here you see a group of concentric circles that really shows the full group of who might be considered in a grand family. The largest circle is actually the number of children that are in households that are headed by a grandparent or another relative. So that would include those multi-generational families where a parent could be there, but the grandparent or the other relative is there as well. So the parent may be playing a role in caring for the child, but in some cases, that relative would be the primary caregiver. The second circle, the 2.7 million, are those children that are being raised by a grandparent, another relative, or a close family friend, and the child's parents are not in the home. So we're very confident that in those situations, that relative is the primary caregiver for that child. And then the third and the smallest circle are those children that are in foster care being raised by relatives. So they're in the formal custody of the foster care system, but they're actually in the physical custody. They're being raised by those relatives. And important distinction there, those that are in the formal foster care system are much more likely to get a more full range access to supports and services, and may have access to a foster care payment, similar to what a non-relative foster parent would get, but not always. So I will speak to that in a minute. We are seeing that the foster care system is increasingly relying on relatives to care for children. Two big reasons for that. One is the research is abundantly clear that children do well in relative care, particularly when you provide the supports and services that they need. The outcomes are very strong for children in relative care. And I'll talk more about that in a minute. In addition to that, of course, the foster care system needs placements for children when they cannot remain with their parents. And so there's increasing recognition that relatives are a critical and available resource for these children. So we've seen over the last decade a really significant increase in reliance on relatives for children that can't remain with their parents. So you'll see the increase from 24% to 32% here. The note here I want to flag is that data is not publicly available on the percentage of these children who are with licensed relatives. Most are with non-licensed relatives. And that distinction is important because only those relatives that are fully licensed are going to have access to that full foster care payment, similar to what you think of a typical non-relative foster parent getting. And that's a significant higher payment amount than what relatives would otherwise get. They're often referred to the TANF agency to get temporary assistance for needy families, or they may have a lesser amount that falls somewhere between TANF or the amount that a typical foster parent would get. Why do these families form? We see them forming for a number of reasons. Certainly high on the list is substance use. In fact, more than a third of all children who are placed in foster care because of parental substance use are placed with relatives. So the numbers are really significant. But in addition to that, we see other issues, including incarceration, deportation or detainment of the children's parents, military deployment, disabilities, death of a parent, and the list is long. This is just a snapshot, but the latest to be added to the list is, of course, COVID-19, when a parent is unable to care for the child or dies because of their infection with the virus. So we certainly know that children thrive in grand families, despite the fact that families face a really significant number of challenges. The data is very clear that children do better with relatives when you compare children in foster care with relatives to children in foster care with non-relatives. Particularly, we see that they have better behavioral health and mental health outcomes. We see that their safety is strong, that they are more likely for their home to be a permanent home. They're less likely to move from home to home. So we see more stability, less likely to switch schools. We also see stronger connections and maintain connections with their brothers and sisters, and connection to their cultural identity. And then the last piece, which is incredibly important, is they have a stronger sense of belonging, with research actually showing that children in relative care are more likely to report that they always feel loved. So those are the strengths. And I think those strengths are really important to be recognizing as we take a look at the many, many challenges that grand families face. And I want to point out in particular that grandfamilies have really been disproportionately hit by three high-profile crises that we've seen really come to the forefront of people's attention in recent years. The first crisis being racial inequity and discrimination, the other being the impact of COVID-19, and the third being the opioid crisis. So when we look at these families, we do see that there is racial overrepresentation in grandfamilies with two particular populations. And it really is similar in terms of overrepresentation that we see in the foster care system. When you compare the overall numbers of African-American children in the United States, they are disproportionately represented in grandfamilies at 25% and in foster care at 23%. And then when you look at American Indian and Alaska Native families, you'll see 1% in the overall population, where we have 8% in grandfamilies and twice the number in foster care as in the overall population. And I elevate this issue because as we're looking at the inequities between how we support grandfamilies and how we support children in non-related foster care, it's not only an issue of disparities between grandfamilies and non-related individuals, but it really is also a racial equity issue because we see this overrepresentation in these families. In terms of some other racial groups, just want to flag that Latinx, Asian, and white children are not overrepresented in grandfamilies without parents in the home, but they are strongly represented in those multi-generational households that have 3 or more generations in the house. A bit more about the demographics of the family, of the grandparent caregivers in the family. We don't have data that looks at those other relative caregivers, but census does collect data on those grandparents who report they're responsible for children. And we have about 19% of those grandparent caregivers living below the poverty line, about 46% having raised children for at least 5 years. So they are stepping into this role and doing it in many cases for an extended period of time. We do see that most of them are working, with 56% in labor force, but many are also older, with 48% being age 60 and older. And then about a fourth report having some form of disability. And then getting back to the disparity issues and the crises, when we look at COVID-19, we see a disparate impact on certain populations. So we see the disparate impact on the older population as well as other subgroups. So we actually see that Black people are dying from COVID-19 at 2.5 times the rate of white people, and Native and Latinx people at 1.5 times the rate. So when you take all those factors together, we're really seeing a strong impact of COVID-19 on grandfamilies in particular. And next, just a bit about the opioid crisis. We did this report back in 2016 and an update again in 2018 as we saw a great deal of interest and attention to the issue. We recognized that as the opioid crisis got increased recognition, it really was the latest in a series of substance use crises that we've seen across the United States. Part of what was unique and notable about it was the sharp increase in the overdose death rate for adults of childbearing age. We did see the impact of the crisis and continue to see it very significantly across the country, but really has overwhelmed child welfare systems and pockets across the United States. And I think it's important to point out, while it was first getting a lot of attention for hitting rural and white America, it is now really recognized in terms of having impact across populations and across geographies. And of course, the intersection of COVID-19 and the opioid crisis makes the experiences that grandfamilies are facing even more complex. And I'll just flag that we do have entire webinars dedicated to the opioid crisis and other substance use and how it impacts families. And those resources are available at gu.org and grandfamilies.org. A bit more about other challenges that kinship families face. Certainly limited financial assistance is a huge issue. So often these families were not expecting to raise another child, And all of a sudden they may get a call in the middle of the night saying, come and take this child, or they're going to end up in foster care. They may be living on fixed incomes and all of a sudden need to be providing, food, formula, diapers, everything for this child they didn't expect to be raising. We also see challenges in terms of the legal relationship. They perhaps were not there. It can be expensive and complex to form a legal relationship with the child in their care, and that legal relationship can be really important in terms of accessing supports and services that the child may need. There is one approach that can be really helpful to those if perhaps they don't have full legal custody. There are certain approaches, consent laws that are available in some states to consent to healthcare, educational, or other services, so that that caregiver that may not otherwise have the legal authority can get what they need to for the children in that way. Affordable housing, we see often families may be living in senior-only housing or housing that is really designed for, one or two people, and all of a sudden their family is expanding and they need a place to go that can accommodate their growing family. And affordable housing is a huge issue, particularly if they're living in senior housing where children aren't allowed or where they are told children are not allowed. Often it's very clear that children should be able to remain with the family, but they're given misinformation and suddenly are finding that they need another place to go. In terms of some of the more clinical challenges that the families face, the children often come into the care of relatives after some crisis has happened. It may be a traumatic event, something has happened that the children cannot remain in their parents' care. And so that traumatic event may result in trauma experiences for the children, or the children may have special needs. So all of a sudden, these relatives are taking on the care of a child, but it's a child that really has elevated needs. And so there's a huge range of challenges that come with that. And then the caregivers often experience a range of challenges as well. So we find, for one, they often they prioritize the needs of the children. So they may stop going to their own medical appointments because they're prioritizing everything they need to do for their children. So they may be neglecting their own health. They also often face challenges related to social isolation. They may have been going to the movies and going out to eat with their friends. And now all of a sudden they have to dedicate everything they have to the children and going to school events. And so they lose the social connections with their peer network. They often are experiencing grief. They may be grieving on multiple levels. They may be grieving over the fact that their grandchild's parent is not parenting or unable to parent in the way that they had hoped. They may be grieving the loss of that role of a grandparent. They had expected that at this point in their life, the grandchild could come over, they could give them cookies and candy and send them home all sugared up. And that was the parent's responsibility to take care of it. But no, now they are the disciplinarian and they are the full-time caregiver. So they experience grief on a number of levels, and then grieving just the loss of retirement and their expectation for what their life may have looked like at this point, and perhaps the security that could come with what they were expecting of their life at this point. Another set of differences that we really want to highlight, I think it's really helpful to recognize, particularly those that are serving and working with kinship families that may work with both traditional unrelated foster parents and kinship caregivers, to recognize there are really distinct differences that should be considered as you're providing supports and services to the family. One is the non-kinship caregiver, the traditional foster parent, really made a decision at some point. They probably talked through it with their family. They decided to become a foster parent. So it was a voluntary and planned decision. They may have planned for months or weeks or even months or even years to move into this situation, whereas the kinship caregiver's decision was often unplanned. And that comes with a whole host of other challenges. So they are able to prepare more when they're unrelated. The kinship caregiver does not do much planning. They may get that call in the middle of the night. The requirements to become a foster parent are anticipated, whereas that kinship caregiver doesn't know what their home needs to look like or what all those specific requirements are to meet the home study requirements of a foster parent. Those working with the non-kinship caregivers or those non-kinship families don't know the family dynamics within the family that they're working with, where the kinship family is going to be familiar with those family dynamics. And when a child goes to live with an unrelated individual, this creates new family relationships, whereas a kinship family, it's going to redefine those relationships that currently exist. So all of a sudden, grandparent becomes mom, and perhaps aunt becomes sister. It's very complex in terms of redefining, and how does the child experience that? How does the family experience that? And you can see, you know, the full list as we go through here. But in addition to the relationships, there's also issues related to perhaps the grandparent or other relative may feel guilt over the challenges that the birth parent are experiencing. And they may feel ambivalence about taking over that parental role for the birth parent. They may have a sense that they're betraying the birth parent by assuming the legal relationship. So they really have this sense of sort of split loyalties or ambivalence about stepping into that role. And those are things that are experienced very differently by the unrelated foster parent. So really important dynamics to be aware of when you're serving and working with these families. And lastly here, I want to talk a bit about some of the challenges for kin in the child welfare system. What we see is, depending on what part of the country, depending on what jurisdiction caregivers live in, when the children come to the attention of the child welfare system, they may be treated very differently, depending on where they are. In some situations, they may be diverted to relative care with little to no support. You know, good luck, your home looks safe, good luck, go take care of the children. In other situations, they may, and in this situation, they may not be offered the opportunity to become a licensed foster parent, or even be discouraged by it. In some cases, they may become a foster parent, but not be given the opportunity to become fully licensed and get the payment. And then other situations, they may get the full payment. So depending on where they fall, that makes significant difference in terms of the supports that they can get in that role. So I'm going to now launch into a quick question before we move into our next section, and then turn it over to Sarah. So we'll launch this poll, just giving a sense of what challenges you have experienced during COVID-19. A few seconds here. What challenges you have seen kinship families face during COVID-19? And we'll see how they parallel a new report that we have done with families. You ready for the results? All right, so I see in the results that the working from home when the internet action at school is at the top of the list. Also certainly food, financial issues, lost jobs, visitation is a big one, becoming licensed, legal issues are up there as well, and health. Thank you. So recognizing that backdrop, just want to talk a little bit about what our survey found. It really paralleled that survey in many ways. We see housing as a huge issue in terms of those being unable to pay for rent or being worried about paying rent. Access to food was enormous. And then we saw huge numbers that just had no caregiving plan for the children. So if they were to die or be unable to continue caring for the children, that they don't have a plan for those kids. So moving from there, I really feel excited for you to have the opportunity to hear from Miss Sarah Smalls, who is a wonderful member of our Grand Voices Network, and she can share her experience as a caregiver. So I will turn it over to you to take it from here, Sarah. Thank you. And Sarah, you're on mute still.
I am sorry. Good afternoon, everybody, and thank you for having us here to speak. I think you might be able to see the picture of my grandchildren. I'm raising my 3 grandchildren. I am the paternal grandparent, and there's a picture of them, what I call it before and after. One of them when they were little ones, and now that latest picture was our casual Thanksgiving dinner because we couldn't have the usual crowd over. All of what Jaya has said, I've been through. And if I haven't, one of my cohorts had. I started out getting custody of my granddaughter, you see here in the picture. And that was extremely traumatic. Her mother didn't really have a place to live, and she was dragging her from hotel, motel, motel, and leaving her with friends who were into drugs. So my husband and I decided on her last visit to us to ask us to take care of Elizabeth while she went somewhere that we needed to do something. She looked as though she didn't understand. She thought, as though she was thinking, where am I? What's going on? She had these big, beautiful eyes, and they just touched your soul. Let me go back a little bit and explain. I am a retired Fed. I was working for the federal government at a pretty responsible job, and most of the time I was on travel. I was the director of a labor relations staff in the Washington, D.C. area, as well as 13 other states. So I traveled quite a bit. I was the person who had the suitcase under the bed and it was ready to go. All I had to do was put the clothes in it, and move on. And all of this started during that time. No thought of retiring, no thought of doing anything except to make sure that we got the house in the Bahamas that we could go to 6 months and come back home for 6 months, because it was just my husband and I, and this is my only child, my son, whose children these are. So grandchildren were not in the picture, except to come over, and I have to correct you, Jaya, not every weekend, once a month, to get all sugared up and sent back, So this wreaked havoc with me. I couldn't find resources. Going through the court system was extremely traumatic and expensive. Didn't know what kind of childcare I was going to get for her. Didn't even know about childcare. My son was not a young person. He'd been out of the home for at least 20 years between going to college and graduating and working. So we were not used to having a child in the house or having to care for a child. Started, as I said before, I started looking for resources, and long story short, ended up being an advocate for grandparents and other relatives raising children. It is tremendously hard, especially when children come with trauma. And most children who, just as foster and adoptive, have some sort of trauma that they've been through. Just the simple fact of having been abandoned by parents is one of the traumas that grandparents go through. And there was nothing around there was no trauma-informed classes back when. There was no way to figure out, how am I going to do this? How am I going to do that? It was trial and error for me, which is the reason I have been in this business since my granddaughter was about 5 or 6 years old and advocating for grandparents and other relatives. There are many grandparents who have 4 grandchildren in 1-bedroom apartments, and they can't afford to move. But then they're told they have to leave because this apartment is only for adults. There are children who have mental health needs that need to have therapy, but they can't afford it. And then there's the caretaker themselves. It's, as Jaya said, you're grieving. In my case, I was grieving for the loss of my son, who was incarcerated. Didn't understand why that had happened. Middle-class family, I guess you would say, 1 child, was raised by both his parents, grandparents, very involved, cousins, uncles, didn't know what, I was thoroughly confused and didn't know what was going on. It takes a lot for us. And unlike foster care, just as Jaya said, you're not given, oh, you're going to get this child on March 15th. And therefore you have some time to plan. We didn't really have time to plan. We were in court, back and forth in court. I'm on the road traveling. My husband was working, and very, very stressful goings on. I worked with Department of Family Services on a volunteer basis to try to come up with some ideas about what to do with people like me. My kids were never in the system. Therefore, there were no resources, really, no funds for them. Everything we did came out of our pockets. Doctor's visits, therapy visits, food, clothing, to this day comes out of our pockets, you know. But when you think about the fact that your granddaughter, your not even 3-year-old granddaughter is being left in motels with drug addicts, that will nudge you to do something more. No matter, you figure I'll make it some kind of way, you know, and you do. You end up making it, but it does take a lot. You're isolated, as they say, from your friends, the friends that I did have that I was going out to lunch and dinner with, and things I was doing, traveling, came to a halt. You know, you can't leave a 3-year-old with just anybody and go to wherever. I'm lucky in the respect that my husband is as much in this, if not more, than I am. We call him Manny the nanny. So he was the nanny while I was continuing my federal job until I retired. You know, in fact, when we got our second child, he decided to retire as well, because now we have 3. We'd already had her brother coming on the weekends from Friday to Sunday, with the intent to roll him into full-time care. So we had all 3 of them, and it's been a journey, and it still is. It's a roller coaster ride, and they're teenagers now, as you can see, and they all have distinct personalities. Elizabeth is 20. Robert, who has the Good Trouble t-shirt on, is 17. And the tallest one, believe it or not, is the youngest, and he's 16 now. And he came to us when he was 4. All very normal teenagers who do normal, crazy things. But when you are 2 days away from 74, you're wondering, what am I doing? You know, there are just times when you don't think anybody else understands. And that leads to my support group that I've been in for a number of years, and have also co-sponsored the support group. They are like the kindred spirits there, and there's somebody you can talk to about whatever went wrong. You know, I grounded them for not doing the dishes, leaving the dishes in the sink, and you know, it maybe broke my heart or whatever, you know. But there are 2 sides to this walk. You're now the parent, and you've got to prepare these kids to go out into the world to take care of themselves, because you know you're on the other side of your life. And they have to be responsible enough to at least start to take care of themselves. So there's quite a difference from foster kinship to just kinship. The journey's been long, and I'm sure it'll be even longer. I don't expect any of them to leave anytime soon, but that's okay, you know, and it's especially okay with their granddad, who adores the time with them. I was the one who had the one child and said no more, but God had other plans, so here I am. Thank you for your time.
Thank you so much, Sarah. Thank you for sharing your story with us. really appreciate what you do for your family, and I know they appreciate you. And for other grand families as well. So what we're going to get into now is kind of the recommendations that come out of our COVID report, which is on the front cover of the slides, which you'll all be getting afterwards. And there's a direct link to that report from those slides. And in the report, which focuses on the impact of the COVID pandemic on grand families, we made a number of recommendations. And like you can hear from Ms. Small's story, the pandemic has really heightened challenges that have been there all along. So there's nothing new that the pandemic, well, there's some new, but essentially all these challenges have existed all along. The lack of access to legal assistance, the affordable housing, the trauma, all of that Jaya talked about and that Ms. Smalls talked about, that is all been there, and then the pandemic has just elevated that and heightened all those challenges. So all the recommendations that we talk about in the report really are aimed at improving supports and services for the families, regardless of the pandemic, except for maybe the second one there about coordinating. But the coordination role is so important when there is no public health emergency as well. So elevating four of the top kind of practice recommendations is really doing what we've been doing at Generations United and has just been instrumental in guiding us and inspiring us, in informing us, really listening to the voices of the caregivers and having them at the table at every step. So when we're about to do a report, we get their feedback. What should the report cover? When we're in the drafting stage, we ask them to review. It really is authentic engagement. It's not just elevating the families here and there, but really having them at your table from the beginning and listening to them and what kinds of services they need, what their families look like. So critical. Coordinating is another one, which is important even non-pandemic times, but really coordinating the response efforts across systems, because like Jai kind of alluded to, kinship is in so many different systems, so many different silos. It's in child welfare, it's in housing, it's in education. So really coordinating all that and making sure that the needs of the families are front and center. Establishing robust kinship navigator programs. And those are programs that link caregivers and the children they raise to services and supports for that very reason, because the services and supports are in so many systems and so many silos. So really having someone to navigate all that for the caregiver, for the child, and to help connect them with those services and supports. And then really using inclusive language in all outreach materials. And this is really elementary, but really makes a big difference. So instead of talking about parents where it's not necessary, talking about families, talking about caregivers, because many caregivers, kinship caregivers, just don't see themselves in the word parent. And so by using that restrictive language, you're narrowing your reach. So just really keeping that simple tip in mind can go a long way too. So drilling down a little bit on these, authentically engaging, and the Children's Bureau at the federal government has come out with some really helpful guidance. And so we have linked it here, and you will get these slides. And it really talks about how you can do these things, like integrating the voices in every step of your services, of your program, having them there throughout, and also listening to the broader population of folks you serve as well through surveys, through town halls, but just making sure that you're really listening to your clients, your service population. And we can help you, like Jai mentioned, connect you with grants as well, because we have over 70 now. So feel free to reach out if we can help in that regard. This is just a tool that we created last year during the CARES Act. And the idea is to really keep kinship families, keep grand families in mind during all these kinds of response efforts. So now during the American Rescue Plan Act as well, just making sure all the systems know about the families and know about their unique needs, and just their challenges that are different and more significant in many ways than parent-headed families during this pandemic. Yeah, Jaya elevated those statistics, and we know that the parent-headed families, that adults are less likely to be in poverty than the grandparents raising grandchildren. They're less likely to be disabled. So they're really significant challenges for these families, and giving and coordinating with other service providers during this pandemic and beyond, and really making sure that the families are included in everything with that language across systems, etc. So this is just a tool that can be used still, and it's linked when you get the slides. If you click on the image, you'll get right to the resource. I'd like to ask you a poll question now about your Kinship Navigator program. So if we'll launch that and see if you are partnering with your local Kinship Navigator program, or if there is one. Thank you. Eager to see how many of you have them, because they don't exist everywhere in a robust fashion yet, but soon. So that's great. The majority of you do partner with your Kinship Navigator program, but a significant portion don't. And then 13% don't have one in their community, and some don't know if one exists. So there's work to be done here, and a lot of the programs are very new or don't exist or are in the initial stages, and there are other jurisdictions where they really are advanced and robust, and we can help you connect as well. So feel free, you're going to get our emails at the end to reach out, and anything we can do to help connect you, we'd be happy to do. So thank you for answering that question. This is a picture from the Nevada Kinship Navigator program, which is a very robust navigator. And I love that picture. At any rate, really, and I talked about it briefly before, these programs are just so essential to navigating all those silos, all those systems, and helping caregivers connect to services and supports that they may not know about, that may be best kept secrets. So partnering with them is so essential. And I've linked here a resource that is more directed at those developing Kinship Navigator programs. But if there's some of you out there that are working on that with your jurisdiction, know that that's a resource too, if you'd like to look at it. It's just a practical minded piece, short, rather short. So turning from practice to policy, what we have seen is decades of federal law really emphasizing the importance of kin, of placing children with kin, and of really reflecting that research that Jaya reviewed, of how those placements are safer and more stable in general. And so the feds have said, let's have a preference. So since 1978, there's been a preference, and really a robust gold standard in child welfare law called the Indian Child Welfare Act that really talks about those preferences for placing children with relatives and with family and with kin and with tribe. 20 years later, the feds said for all children, there's a preference for placing with kin when they're removed from their parents. So we're talking about the child welfare system involved children, but that there is this federal preference for placing children with kin where it's possible. And all states have followed suit with some level of preference for placing children with kin when they're removed from their parents by the system, by the child welfare system. The last three laws elevated here, and there are more, some as recently as last week, but these three really build on the notion of identifying relatives, notifying relatives, engaging relatives, supporting relatives when children are in the custody of the child welfare system. And the Family First Prevention Services Act also has services for those who are outside the child welfare system, like the Kinship Navigator programs. So really trying to support kinship families better at the federal level and at state levels as well, that's kind of following suit. So we're seeing a lot of reform, but some challenges that we need to address as well, that are being heightened. 4 federal policy recommendations that we made in that COVID report that's on the cover. One was funding and establishing a really national technical assistance center. I'm going to talk about that in a minute. More money for kinship navigator programs, that equity for all children that are in the foster care system, really making sure that those children that are placed with kin are treated the same as children that are placed with non-kin and are supported, and increasing and improving access to temporary assistance for needy families. Because like Jaya said, it's really one of the only supports out there for many of these families, monthly financial assistance for many of these families. So the National Technical Assistance, on the good news front here, was just $10 million was just appropriated for it as part of the American Rescue Plan Act. And the vision of this center is that it's going to provide holistic technical assistance to agencies like yours to really coordinate and to serve the families better, and to be able to leverage and maximize your resources so the families are better served. It won't provide direct services to the families, but the idea is that it will help you all better directly serve the families and other agencies like yours. This money is going through the Administration for Community Living, which is the aging part of the U.S. Department of Health and Human Services. They'll oversee it and they're going to contract out for it, but it is intended to help the array of agencies that support kinship families. So all those various systems and silos. In terms of kinship navigator funding, as in late December, as part of the Consolidated Appropriations Act, we saw some more federal money for these programs. So there's now been 4 consecutive years of $20 million that's gone out to states, tribes, and territories on a non-competitive basis to try to develop, enhance, and evaluate these programs. And as part of pandemic relief, the feds have also said you can get 100% of your kinship navigator program and evaluation costs reimbursed by the feds dating back to April of 2020, so essentially when the pandemic began, through September of this year. So good news, the pandemic will be over at the end of September. But anyway, so there are really 3 excellent pots of money currently. The 20 million that for next year, that will go out at the end of this year and will cover through next year. So what are the expenses that can be used with this, can cover? What expenses can this funding be used for? And it's really everything. It's evaluation costs, it's program costs, it's direct legal services. And I know there are a number of legal providers on this webinar and know that that kind of assistance, like the alternative care planning, helping caregivers inside and outside of the system get guardianship, get adoption, all of that is permissible under these funds. So really, reach out to the Kinship Navigator, and this money trickles to the Child Welfare Agency in the Title 4E agency, they call it. So it'll be the state Child Welfare Agency or the tribal Child Welfare Agency, and really connect with them and elevate that. This is very flexible funding that can really be used to support the families with direct goods, concrete goods, legal services. And you'll see here more information about how to participate in that and what all that covers, including COVID testing, by the way. So like Jaya talked about, the support for children within child welfare, yes, if the children enter foster care, the children and the caregivers are more likely to be supported, but many are not, like she also said. So the majority of these children who are with relatives in foster care, the relatives are not licensed. They do not get foster care maintenance payments. They don't get that array often of services and supports that go to the children with non-kin. And why should children be treated differently based on who's raising them, who's caring for them? So we have been working to promote that all children who are in the legal custody of child welfare system should be with licensed kin so that they can get that array of services and supports. Well, how do you license kin? That can be challenging, right? So where you can start, where the systems can, where child welfare can start is really looking at the licensing standards and making sure that they don't cause unnecessary barriers, and that the child welfare agencies use the authority to waive non-safety related licensing standards. And states and tribes can define non-safety as they see fit, with just a couple of exceptions. So really licensing more relatives so that they can get those same services and supports as children with non-kin. And then the TANF. So like we talked about, it's often the only support for the children who are with unlicensed kin in foster care and who are outside the foster care system. So the child-only grants are supposed to be based only on the income of the child and only for the child. So they're smaller grants in nature, but they aren't supposed to look at caregiver income for the child to qualify. There are 3 states that do, but most don't. And so almost all kinship families are eligible for this, but it's often a really best kept secret. States don't talk about child only or make passing mention of it. So we have this resource that's directed at caregivers that answers some basic questions and has the names of the programs for each state, because often states call their TANF program something slightly different. And like Jaya elevated, and just to kind of give you an idea nationally, this is based on, and unfortunately these numbers are 10 years old because it was the last time kind of this national average was crunched, and this was crunched by the Government Accountability Office. And you can see that one child, the national average, and a lot of states it's a lot lower than this, but for TANF child only for one child is $249 a month, or was, and it hasn't gone up that much. And the national average in foster care, in licensed foster care, was double, $511. And that comes with automatic Medicaid, which is huge for these children and families. So you can see kind of the disparities and why it's so important that we support the children that are in foster care with relatives in an equitable fashion, and that we improve TANF support for all those other children that aren't in the care of the foster care system. Because what this all really boils down to is making sure that the families have a continuum of options, of legal relationship options, of public benefit options, of supports, of services that speak to their family and their needs. And that's basically what we strive to do at Generations United, try to help people do, agencies and systems. So wanted to end with sharing some resources with you that we haven't elevated yet. And all of these have links. So there's the grandfamilies.org website, which is a national website and it basically has all of the national kinship resources on it, and all the ones I'm going to talk about right now. There's state fact sheets for each state and a national fact sheet. And these are in the process of being updated, and they will be fully updated by the end of next week. So your state will be there, and these are tools to be able to share with the caregivers. So you can give them to the caregivers, and it gives them really contact information for support groups like Sarah's and for services that are really helpful to the families. Then we have an opioid tip sheets, practical information for, again, a caregiver resource to share with them. All of these are free, by the way, and please share them and disseminate them widely. COVID-19 resources for the families in English and Spanish, available at this link. These are our newest resources that we've just created for a number of states, including 2 more that aren't listed here, Pennsylvania and New Mexico. And they really are directed at the families within the foster care system to exit to permanent families, to exit foster care and create permanent families. And this kind of gives like all the, not all the, but many of the things that families should consider. And it can be helpful for those families outside the system as well. And this is one last resource that can be used with the caregivers. It's a bit dated, but we think it's still useful, so we wanted to share it with you as well. Then in terms of helping agencies and advocates, We have a policy brief on educational and healthcare consent laws, which allow those caregivers, again, giving them options outside foster care to be able to consent to healthcare and enroll children in school without having a legal relationship with those children. We have a new checklist for child welfare agencies. That's really what this is aimed at, around really making your agency a kin first agency. And then finally, we have some upcoming webinars in May and July that will talk about our toolkits for serving Native American grandfamilies and for serving African American grandfamilies. And here is our contact information for the three of us. Please consider us all resources. Please feel free to reach out at any point with anything that we can answer. And I apologize, we only have a few minutes for questions, but again, if we don't answer your question, just reach out by email. I will turn it over to, I believe, Beth.
Thank you, Anna. We do have a couple of questions that have come in. The first one has, any of the grandfamilies you dealt with had licensing issues due to the requirements of the Adam Walsh Act?
So the Adam Walsh Act, and I get this question a lot, but the Adam Walsh Act is really actually, when you look at the federal law itself, which is the federal law that requires criminal background checks and child abuse registry checks, it really only bars kin and non-kin from being foster parents if they've committed violent felonies and been convicted of violent felonies, or they've had a drug-related offense, been convicted of it in the last 5 years. So in my opinion, the Adam Walsh Act is really quite reasonable, and nobody should be serving as a foster parent under those circumstances, whether related or not related. What happens is, in virtually every single state, is that they try to align Adam Walsh with their own criminal code, and they come up with these barrier crimes and prevent suitable relatives and non-relatives from being licensed for crimes like unlawful assembly in Virginia. Sarah can tell you about that one. Catching too many fish on their fishing license in Washington State, because that's a felony. So just ludicrous outcomes. And it's really, honestly, something that needs to be addressed at the state level, because Adam Walsh, I don't think, I think it's pretty reasonable. But the states go crazy.
Okay, thank you. And the second question is, can attorneys who help grandfamilies help relatives with expungements?
With expungements of criminal records?
It doesn't say, but I think that's what they were referring to.
Well, I guess it would depend on your jurisdiction and how all of that works out, but it's certainly worth a try. I don't think I can give you a better answer than that. I apologize, but feel free to reach out if you want to talk more specifics.
Okay, great. I don't see any other questions. Just wait a couple more seconds just to make sure nobody's submitting.
Sure. And thank you for having us all today.
And thank you, Anna, and thank you, Jaya, and thank you, Sarah, so much for taking the time to be here with us. And thank you, Sarah, for sharing your story. Just a couple of quick reminders. Please complete the post-event survey to be distributed via SurveyMonkey and offer us any feedback or suggestions you may have for future development efforts. The webinar was recorded, and the slides, as well as all the resources you saw on the slides, will be distributed in the coming weeks. And to support future planning for webinars, we ask that you please submit ideas for consideration to ovc-tta@jbsinternational.com. We will be holding our next webinar on Wednesday, March 31st from 2 to 3:30 p.m. on sustainability, preparing for when the grant ends. That announcement has already gone out to grantees. And then, as Anna mentioned, there will be 2 more webinars from the Generations United folks on African American grandfamilies and on American Indian and Alaska Native grandfamilies. And those will be scheduled in May and July. So please stay tuned for announcements on those. Thank you, everybody. Have a great week.